Welcome, dear friends.
Hello everyone.
Today we have the esteemed Dr. B V Balachandra. He is a multi talented person and he is one of the most popular and most prolific allergy practitioner in Bangalore. I am very privileged to talk to you, sir. Today I have a couple of questions to clarify to the patients and to the doctors. Patients come with a varied set of questions. One of the most common questions what we get is there a blood test by which I can make out a simple test without spending too much? Is there something which I can do to say that my child has any allergy or not? And many patients who get referred to us come with some blood tests saying there's a high Ig level, high blood eosinophils, and some other random tests which I can't make any interpretation. What is your take on this, sir?
So we have to here understand the question properly. First question is there an allergy present or not present? The second question is what allergy is present? Answering the first question, allergy is present or not present, before we go on to the test, a doctor will be speaking to the patient and asking certain good history. That means what problem does the patient have? Does he have a cold or a cough or a rashes or he gets some problem or with eating particular foods? And if these kind of a cold and cough, is it persisting for longer time? And does the patient have sneezing? Is it having at a particular time? So based on the symptoms, we can actually tell whether this is an allergy problem or this is not an allergy problem. Add upon to that, sometimes we will require a blood test like eosinophil count or total IgE. This eosinophil count and total IgE will be actually increased in many conditions, in allergic conditions, non-allergic conditions also. But in all the most of the allergic patients, this eosinophil count and serum total IgE will be elevated. So these tests will tell that a patient is allergic, may be allergic or not. It won't give you any more information. And we would suggest that a good history will do the same job and will give you the same information without even testing an eosinophil count and total IgE. So for identifying whether allergy or not, good history is the most important. Sometimes if you need it, probably you can supplement it with eosinophil count and total IgE. Now coming to the next question, what allergy is the patient having? There again a good history based on the history, you might ask certain allergy tests like a skin prick test or certain blood tests and then identify what allergy is present. So I hope I have cleared the answer.
Perfect, sir. And I have a common question what is asked by every parent. Can I give bananas? Is biscuits causing any problem to my child? I mean, I have stopped giving milk to him. I mean, what should I do?
This is a very, very common question. Now let it be a banana or a biscuit or a curds or whatever it is. Most of the times it is presumed that these food can cause symptoms, and many a times it is because somebody else has told that their child had a problem, or somebody else has told that after eating banana this happened, that happened. Now based on that, we should never make a decision that my child is allergic to this food and I will not give. Please understand, these are all very essential food for our life. Biscuits definitely are not good because it is actually a junk food. It is a junk food, but wheat as such is a healthy food if you use it appropriately without converting into a maida, using it as a whole wheat. It is a healthy food. So why would you deny a child in healthy food, wheat like a wheat, without even having a clarity of diagnosis? Coming to banana, banana is a very, very good fruit and healthy fruit. But if Your child after eating banana has multiple times, say every time when you give banana, child has got some amount of symptoms, it can be a cold or a cough or a congestion, then you should get an allergy test for that. Let it be banana or let it be wheat, whatever the products, and if the test is coming positive, along with the test talk to a specialist. If a specialist confirms it and tells you not to eat, then you should not eat. Otherwise, just presuming and not giving a food is actually an injustice to the child. So my sincere request is, if you suspect of any particular allergy, talk to your doctor, take his opinion, get a test done for that particular product, maybe a banana or maybe a wheat or anything, and with the report, with the specialist advice, then make a decision. Just like that, without even confirming, denying the healthy food for a child is actually not good for his growth, and it might have a little bit of psychological impact that child may start feeling that, okay, I am not supposed to eat this, I am different. So why do we have to get into that? And most of the times these foods are non-allergic. Rarely it can be, but most of the times it is not.
So, when a parent comes, he says, I'm not giving milk. Um, that's possible in certain cases when you suspect a cow milk protein allergy. When do you suspect a cow milk protein allergy? And what are the symptoms? And how should we be approaching those children with cow milk protein allergy?
Yeah, very good question. And actually, in our country, food allergy is gradually increasing in number compared to where we were in the few years or decades back. Cow's milk protein allergy is also one of the common condition. Now, cow's milk allergy can present at different ages with different kind of a symptoms. Now, you can broadly classify into whether the reaction of after taking the cow's milk happens immediately or what symptoms. Let me give an example. A child drinks a milk and within few minutes to hours a child gets rashes on the around the mouth or rashes around the body, and child starts vomiting or having cramp or crying excessively, or behavior changes, or sometimes it can be quite dangerous, like causing breathing difficulty. This is definitely an allergy, and it is quite dangerous one also. Here the immediate attention is to stop the milk, visit a specialist, plan for a test, and then make subsequent decision making. There are some types of milk allergy where you don't get immediate symptoms. You may get delayed symptoms. Like for example, a 3-month-old baby or a 4-month-old baby can have a blood in the stools just because mother is drinking coffee or tea with milk, and actually the cow's milk is entering the baby through the mother's breast milk. And you know that if we give a formula milk or direct cow's milk to the baby, it will be much more worse. So these type of conditions, your allergy test may not come positive and symptoms may not happen immediately after consuming the milk. It may happen little later, like it may take few days also to show the symptom. But as soon as you stop the milk, the bloody diarrhea starts coming down. So this is not just one example. Some of the other conditions are also known that after drinking milk few days later, 1 or 2 days later, child can have kind of an abdominal pain or abdominal cramps or bloating sensation. Many of these symptoms can be present. So basically, milk allergy can be two types. One is immediate type, that is called IgE mediated allergy. Then delayed type, which is called non-IgE mediated. And please note, whenever we are testing, we are only identifying IgE mediated. Good history is the way we identify non-IgE mediated milk allergy. Either IgE mediated or non-IgE mediated, when you suspect and when you are clinically right or even the test is supporting, you will be avoiding the milk at least for a significant amount of time, maybe even 6 months to 1 year later. Again you retest the child and then make a subsequent decision. You will never allow them to drink the milk without your consent. That is something which we need to be very, very clear about it. Okay. So sometimes it may not be milk allergy, it may be intolerance. especially little older children or adults, as and when the child grows older and older, they have a less capability to digest the milk. In fact, milk may be less essential after 3-4 years. Even if they are consuming, they should consume small quantity, because the capability for a older child or an adult to digest milk is much less when compared to a small child who has got a more capacity to digest milk. So sometimes a older child and adult, when they take a milk, they may not have allergy, but they might have a uncomfort, discomfort, bloating sensation, constipation. So this is more of an intolerance issues, or not an allergic issue but an intolerance issue. So maybe that also may be a reason sometimes you may have to suggest that decrease or avoid milk. Okay, but first important thing, is it allergy, non-allergy? If it is allergy, whether it's immediate type reaction or delayed type reaction, and whenever you are suspecting, possibly do allergy test. With all this combined information, make a decision.
The another question, what's probably the most important thing is it a permanent condition?
It is like different for different people or children. Most of the cow's milk allergy children, up to 90% of them, at a particular age, they will come out of this cow's milk allergy and they start tolerating the cow's milk. Like I gave an example, like child with 3-month-old having a blood in the stools called proctocolitis. Many of these children, after 1 year, they'll be able to tolerate the milk. Some of the children having rashes after taking the milk, maybe after few years, like 3 years, 4 years, 5 years, they'll be able to tolerate the milk. That is why we need to do the test year on year, see the report, take an history, and then make a decision. But there are about 5 to 10% of the children, they may have this milk allergy for long term or lifetime also. So every patient is different. So we need to know that most of them will come out. We need to serially follow, but some of them may not come out. There are certain blood tests which can probably guide that this child will come out of the milk allergy or not. Those are called as component resolved diagnostics, where they test for different kind of a milk proteins, like say BOSG6, BOSG8, BOSG4. This BOSG8 is one of the protein. If it is positive, it will have a severe allergic reaction to the child, and very unlikely that this child will come out of the milk allergy even at the later part of the life. So this can probably help us to guide and then follow up with the patient.
Thank you so much, sir. The message here is loud and clear. Milk is a very safe product, and milk is not the cause of cough and colds. There are few unfortunate children who have allergies. Even if they have allergies, more than 90% of those children do overcome their allergies. There are certain unlucky children who may never tolerate milk. That's the message, isn't it, sir?
Absolutely, Dr. Manjunath.
Thank you so much, and we are very grateful to Dr. Balachandra for talking about milk allergies and other allergies in my channel. Thank you so much, sir.
Thank you, Manjunath. Thank you for giving me this opportunity. Thank you, everyone.